Hey everyone, my name is Neil and I'll be demonstrating the functionality of send button in the progress note, which we often refer to as the common send button. As you might know, the final steps of a patient encounter may involve orders that include medications, labs, diagnostic images that need to be sent to the pharmacy or lab or diagnostic imaging company. Or you might also want to send consult notes to another provider to ensure continuity of care. The above tasks may need to be done individually or in groups depending on the encounter and often need multiple clicks to accomplish all three. The send button helps consolidate all of those tasks into a single window called the common send screen, and this reduces the number of clicks to accomplish which I specified earlier. It also helps you to customize and apply certain criteria before the order is transmitted. The gray send button is available on the bottom right of the progress note in the treatment window. You would click on treatment. On the treatment window, you have the send button right here. If you see this drop up right next to the send button, this allows you to individually perform the tasks that I specified earlier. So let me click on the send button and show you what it does. Now, the first thing you notice is that the common send screen, it consists of two tabs, patient orders and the for patients tab. Patient orders contains prescriptions to be sent to the pharmacy, lab orders to be performed at lab companies, diagnostic imaging orders to be performed at radiology companies, and any consult notes to be sent to other physicians. The For Patients tab provides the ability to print, fax, publish the patient education, medication education, visit summary, and immunization records for each encounter. So let's take a look at each tab in a little more detail, starting with the patient orders tab. Notice at the very top is the medication section that brings up all the prescriptions ordered using the treatment section of the progress note. The mode of transmission for medication will default to e-prescription if the patient's profile has a preferred pharmacy that accepts e-prescriptions. And now this holds true for both controlled and non-controlled substances. Just keep this in mind. For controlled substances, the provider has to be activated for electronic prescription of controlled substances. Fax and print are other modalities that are also available as an option on this if you click on this drop down. The C icon represents controlled substance. So if you see the C icon turn blue, that'll indicate that this is a controlled substance. And S icon, if that turns blue, that denotes that the provider has allowed a generic drug substitute to be dispensed at the pharmacy instead of the one prescribed at the time of visit. The drop downs on the top of the medication allow the provider to choose a DEA number. If the provider has more than one linked to his or her license, it also allows them to choose a different pharmacy from the list of preferred pharmacies on the patient's profile. It also gives them the ability to specify a supervising provider by typing in their last name over here, or they can add notes for the pharmacist right here and then hit apply to selected, and that'll apply to all the selected medications down here. If you notice that the medication name or the SIG of the medication is incorrect, you can change that by clicking on the medication itself. This will take you back to the edit medication window. Right next to the medication, we have the pharmacy name. So if the patient had a primary pharmacy in the system, that would automatically populate over here. And since this is a patient who does not have a primary pharmacy, you're not going to see anything over here. If you wanted to change the pharmacy, you can always click right here and change the name of the pharmacy from right here as well. Right next to the pharmacy, we have the duration, dispense, and refill values. In order to be able to e-prescribe, you want to make sure that there's a numerical value in duration, dispense, and refill. Right next to that, we have the comments for the pharmacy. You have the DEA number, and right next to the comments, we have a little green check mark at the end of the order that denotes that the order is ready to be sent without any issues. If you see a red exclamation mark instead of a green check mark, that denotes that there's an issue with that order. And if you hover over the red exclamation mark, it'll tell you exactly what the problem is. Similarly, the other sections in the window related to labs and diagnostic image work the same way. Once a provider orders a lab or diagnostic image from the compendium, the provider can choose a lab company from this drop-down list, state the specimen source, indicate a collection date and time, as well as document comments and change facility on the order. Just as in the medication section that we saw earlier, the provider can also apply the criteria selected at the top over here to one or more labs. These orders can be transmitted by an electronic interface. It can be faxed, printed from the common send window. The print icon on this section allows the clinic to print a label for each lab order, and the I icon provides a quick summary regarding the order and can be accessed by hovering over it. If you see an IH right here, that would indicate that this is an in-house lab. If you have the SP checked off, that indicates to us that the specimen has been collected. Let's take a look at the next tab, which is for patients. Here the provider can print or publish directly to the patient's portal education material. The provider can make predefined selections on sections that should print on visit summary by clicking on the notes icon with the plus sign. Now, once you click on that icon, you can select the sections that you would want on the patient's visit summary and hit OK. The printer settings button at the bottom allows the practice or user to set defaults or make ad hoc selections of printers based on the type of information being printed. You can change the printer by clicking on this little pencil icon on the right corner, and you can change the printer. One classic example is choosing a different printer for controlled substances, while the default is OK for non-controlled substances. So we looked at the common send button from the treatment window, but we also have the same exact common send button at the bottom of the progress note right here. Common send window can not only be opened by clicking on the send button, but is also triggered when the provider clicks on the done button in the billing screen, indicating the virtual completion of the note. There are two settings that are related to the common send button. One is the practice default setting. In order to get there, you want to click on Menu, File, Settings, Practice Defaults. On the practice defaults window, you want to click on Scanning Printing. And you have the ability to check this box which says Show Print Dialog after Done button is clicked on the billing screen. Once you check this box, this will allow you to configure the default modality for each order using these check boxes right here. The second one is a My Setting. In order to get there, you want to click on Menu, File, Settings, My Settings. Once you are in My Settings, you want to click on the Defaults To tab right up here, and right here where it says Done for Print, Fax, and Transmit. This over here, this setting right here gives you the ability to choose between Modern View and Classic View. Once you change that, you can click OK, and the system will give you a prompt to log in again. So in that case, you want to log out and log back in, and your changes should take effect. On the common send screen, once a provider clicks on the send button, the selected orders are transmitted through one or the other modality. Thank you for watching this video on the common send window.